you would get into a matatu and somebody would start asking you, nini mbaya na mtoto? Now you're like, okay,
where do I start?
Am I supposed to be explaining myself to everybody? Like, the unfortunate thing is I was comparing the two, even with other kids, because I think there's also a neighbor who had a baby at I think same period. So you see, I would look at mtoto wake na milestones zake na za Bobby. They were different. And I didn't voice my issues. To date, we have our issues, and sometimes I know I blame myself because I was not there for her. I think I gave Bob most of my attention, and I forgot she existed.
Welcome back to the Mamatoto Lounge. A heartfelt thank you for the new subscribers and for everybody who has been sharing and keep the conversation going. Asante sana, we really appreciate you. We have received the emails and feedback, and we are going to reply each one of them, and we are working on it to make sure that each dream, each guest will be hosted here as per your requests. We are still at Prinyas Hotel, Kisumu. Remember, when you're looking for accommodation, good food, conference halls, they are available here at Prinyas. Our today's guest is a mother who is a strong mother, and her story is all about resilience and love. She is going to walk her personal journey. Remember, it's all about parenting journey, all unfiltered at the Mamatoto Lounge. So without much, karibu sana our guests. We are so proud to have you, and you are doing a good job. And above all, you are looking all nice. Karibu, please introduce yourself and tell us who you are.
Hamjambo, naitwa Joan Magoe. I'm a parent. I've lived in Kisumu for the longest time. I'm a mother of two. My youngest son happens to be a special needs child, and it's been a journey that we have walked, and we are still walking. He's now 16 years. I'll take you through the process of our journey.
Wow, karibu sana.
Asante.
You know, you've said 16 years, and I'm like, wait, did we miss some years? Did we fly somewhere? Because 16 years of courage and resilience and to a special need. Please take us through. How did we start? And okay, who is elder?
I have two kids, a girl and a boy.
Okay.
My firstborn is a girl, 22 years.
22
and
years.
And then my boy, 16 years.
Okay.
Who's the special needs child.
All right.
Yeah, so my first pregnancy was okay. I didn't have hitches. I would say I carried it to term, gave birth to a healthy child. She grew up well. Then 6 years later, I got pregnant again. But this one, from the onset, I think I had problems because I couldn't eat anything and keep it in.
Okay.
So I had to be put on medication to help with, because I was vomiting and vomiting and vomiting. And then I was given medicines to help control the
vomiting,
the nausea, even my own saliva. I couldn't stand it.
Oh.
So with time, and then there were issues of candidiasis that was uncontrollable.
Throughout the pregnancy?
Most part of the pregnancy.
Okay.
Because I was put on antibiotics that I was not responding until I had to be given some injection, I can't remember, to help with it, because it was so persistent, and you can imagine. It's not an easy thing.
The discomforts.
Yeah, so I started my antenatal clinic. I've been working in the hospital, in the medical sector for a very long time. So even in my pregnancy, I was working at Maseno Mission Hospital.
Okay.
So I attended my clinics there. So around my, I think, 5th month of pregnancy, when I went for my clinic, my blood pressure was elevated. So I was started on medication immediately, because I think in pregnancy and blood pressure.
Yes.
So I was given medication, and then now I had to go for my clinics on a weekly basis because of the blood pressure.
To monitor the blood pressure, yes.
When I went back for my next visit, the blood pressure was still high. I continued with the medications, and then I was put on bed rest. But it wasn't getting into control.
Even with medication?
Even with medication. So I went on with the drugs, and okay, unfortunately, nikaanza kufura mwili. Like, I was falling all over. So it became a concern. So with the bed rest, with the medication, and here we are, I'm still having the blood pressure. So with several consultations, this time, okay, I might not remember the sequence.
Yeah.
Because it's been a
It's been a while. Years, yeah.
So,
and I'm so glad you're still remembering the most, yeah.
When I think I was about 6.5 months far gone, when I went for my clinic and the pressure was high. This time I got admitted. Actually, I was staying within the hospital, but I had to be admitted because they were like, now we need to monitor you on a close.
Yes.
I was admitted for 2 or 3 days, and then I was discharged again on total bed rest. But in the process of my bed rest, I think something disrupted me, because it was like on a Friday when I was discharged. I'm on total bed rest, and then my mom, I was staying with my mom.
Okay.
Though I was married then,
yes,
but I was staying with my mom. So my kagal, my mom opted to go with her, Ushago, and leave me in the house so that I would have ample.
Total, yes, total rest.
So in my rest, I think something triggered, because actually the blood pressure had a bit taken, ilikuwa imeshuka kidogo, but something disrupted me. By the time they were coming back on Monday, it's hit the roof. I'm admitted again. They tried to control it this time. It's not going down. Our main physician there, he was called Professor Haddison, chose that I should be brought to Kisumu for further management because it was not...
It's now severe.
Yeah. So, long story short, I can't remember, but how it was, because me nakumbuka tu, I came in the ambulance. How was it? Sikumbuki.
Yes.
Yes, I was very conscious.
Yes.
Nini, but yeah, I was brought to the emergency. Russia.
Okay.
Yeah. I was brought there at the emergency.
The current GTRH.
I got admitted, and in the labor ward, there's a place for serious cases. It's called the emergency, whatever, something. I can't remember. So I was put there. Day one, they still tried to control the pressures. It was not going down. Day two, same. So the gynecologist in charge decided that I had to be induced because the pressure was not going down. So baby had to come out of me even before time. So I was put on steroids to help improve his lungs so that he can, akitoka, at least he can breathe on his own.
Yes.
And then the induction process started, which was, it's one of the most painful things.
Yes.
Because you're in pain, you can't move, and then you're not the only person there who's having to give birth to prematurely.
Yeah.
Somebody next to you is giving birth there. A baby who's 600 grams. You're looking at it and you're like, God, I am next.
I am next. Is this what I'm expecting?
Yeah. So I was induced in the night, but it didn't work. The gynecologist had to come in the morning, rupture the membranes physically, and sasa wakaanza hiyo induction ya drip.
Yes.
So they had to keep checking the baby's heart rate. They keep checking my blood pressure.
Yes. You are in close monitor.
Yeah. And pia wanaangalia how far I am in my nimedilate to how far.
Yes.
Okay, it didn't take long because I remember when the nurse wanted to come and do the VE to check how far, I told her I feel like pushing.
Okay.
Yeah, nafikiria bado because by the time she was coming, actually I never had time. Haungeza nifikisha naitwaje delivery room.
Yes,
because by the time she came, she left. She was coming to check. Alitoka na mtoto.
Wow.
The boy came just like that. His scores were normal. Mnaita
the APGA score.
Yeah.
Yes.
They were very normal.
Yes.
But I was scared of that baby because I'd seen somebody give birth to a very tiny baby, so I couldn't even look at him. So the doctor ananiambia, "Hebu angalia mtoto wako," namwambia nitamwangalia baadaye. I was so scared because it's traumatic seeing people give birth to very, very tiny babies.
Yes.
But okay, I gave birth. At birth, they said he was 2 kgs. And they decided that with that weight, they were not going to put him in the nursery. It's okay.
Okay. Yeah.
So they gave me the baby to stay with him. But my mom is also a medic. She's a nurse.
Okay.
She had stayed with me the previous night, had just left to go and report to work, and came back. When I called her and told her I've given birth, she came back. But when she came back, she found the baby had distress breathing.
Okay.
So she asked, "Mbona mjeka mtoto kwa nursery?" Akamwambia, "Tuliona weight yake iko sawa, maybe anaweza nini." No. Akamwambia, "No, this baby needs the nursery for some time." So they decided to put him in the nursery, but they only put him there for 2 hours. Okay. And then they brought the baby back.
Okay.
Now we started our journey. A baby being premature is difficult. Hajui time yake ya kutoka iko imefika. So this kid does not know it needs to suckle or do anything. So I'm told I have to keep tapping his feet after every 2 hours to wake him up to suckle. Hana hiyo muscle grip.
Yes.
Hawezi shika matiti anyonye. Yes. So it was, you have to keep waking him up after every 2 hours. Saa zingine ataamuka, saa zingine uta struggle, umwache. I was there for 2 days and then I was discharged. I went home and while we were there, I didn't go at my mom's place because I went kwa kina my kids' place.
Okay.
So after a day like so, my mom called me and told me, "Hey, you have to be keeping ukipatiana ukieka mtoi kwa ile jua ya asubuhi."
All right. Okay. Yes.
To avoid sijui jaundice or something.
Yes.
So I'm like,
who are like mothers.
So but the boy was tiny. Hata unaogopa kumtoa nguo because ni kamtu kadogo. But I kept trying to do that, but I think maybe I wasn't doing it right, sijui. But on day 2 or 3, okay, 5 days down the line, I think the baby developed that jaundice. That is what I can say, because this day I was home alone, and I woke the baby up at 8 to breastfeed, and then from then he totally refused to wake up.
Just hold there and just take a note to our viewers. There are terms, and that is why you have to be at Mamatoto Lounge all the time. There are terms that mothers hear from medics. She's not a medic, but there are terms that she's using that needs a lot of explanations. As usual, in our specialist corner, we are going to bring these doctors who are going to speak. Please note, you have heard candidiasis, you've heard the word premature, now you've heard the word jaundice. So what is jaundice? We will definitely get to answer you all those questions. But however, just for today, jaundice is when the baby turns yellow. The skin turns yellow. Other details will be discussed by the specialist. Back to you, Joan.
So on day 5, I think, the baby refused to just totally wake up. After he breastfed at 8 a.m., I tried waking him up several times. He would just open one eye. You put him to suckle, puts his mouth and then drops.
Sleeps.
The nipple sleeps. So it went on to until 3 p.m. bila ye kuamka. I kept calling the father, but he was busy at work. Then I ended up calling my mom, and I was like, hey mom, mtoi amki kunyonya. Been trying the whole day, but hamuki. Anafungwa tu macho kidogo, halafu anarudi kulala.
Yes.
So my mom was also at work, but she told me, let me finish work. I'll see what to do before the end of the day. Okay, by the time everybody else was coming back home, it was around 5. I think I'd cried my all because
the baby has not fed. Your maternal instincts.
This is not normal.
This is not normal.
Yeah, I'd been told because he's premature, he's sijui alikuwa ile stage yenye bado analala. So it was going to be like that, but this one didn't look normal. So my mom came around 7 or 8 in the night. And when I gave her the baby, she just told me, baby has jaundice, so we have to go. We see how we will manage it from the hospital. So we left with her that evening, went to Maseno. They started checking the bilirubin levels.
Yes, all those medical things.
So the thing was, instead of them zibaki same level or kurudi chini with, they started him I think on antibiotics or something to help manage. But instead of them going down or remaining at the same level, zake ziliendelea tu rise. They kept rising and rising until zilifika about 17 koju. They went high. So, and again now we were told now I have to go back to Kisumu. So we came back. Somehow I found the treatment I got there not quite welcoming because tulifika, the doctor who saw the baby akasema, imrudi to home. You go and manage it from home. So we went back home. But also because I was staying in Maseno, at least my mom was checking on him, and then we had a physician there who kept trying to check, but he alikuwa anasema this needs an admission so that this kid can be put on phototherapy. Yes. So again we stayed another day or so. This time again we went back to like, he's not waking up, he's not breastfeeding totally. So this time it was distress, complete distress for the baby. So we came back to Russia and we got admitted. He was put on phototherapy. The pediatric ward that we were put in was for underweight babies because he had lost weight.
Yeah, because he's not been feeding.
Yeah, from the 2 kgs he had gone to 1.7. And in that sijui mnaita nini, sijui ni katini ama incubator or whatever it is, they wanafunika macho because I think the light is not good for the eyes.
Yes.
Trust you me, the boy was very active and anavuruta. So most of the time I had to stand on next to that so that I keep
covering the eyes.
I keep covering the eyes so that it does not affect his eyes.
Yes.
This was day and night for 3 days. You have to be there because you take us, tunaka chini tu kidogo, ukirudi unapata imesonga.
Ameshasongesha.
Ukirudi unapata imesonga because 1 minute ako hii side, next minute amefika the other end. So it was hectic, and considering the environment too, babies are dying. Unaona watu wakikufa, you worried, you keep asking yourself, am I the next one?
Oh yeah, is my baby next?
And my boy was so tiny, ukiangalia, sijui his thigh was sijui this size, hata sijui alikuwa anapata aje veins za kuweka dawa because he was small. Even when he was born, he only had his poop hole. Hakuwa na matako.
Wow, that's a tiny baby.
So while there, I got sick with malaria. I have to handle this baby. Public hospitals, they do not allow you to have a caretaker. So you're going through all this, you're sick. You have to stand there with the baby. You have, and this time they'd put a tube in him.
Oh, okay.
So, because he was not feeding.
Yes.
So I had to express milk. And that time, I think 2009, there were no breast pumps, if I remember. Because you had to manually press to get the milk. It was quite painful because, number one, as much as you're trying to feed, the anxiety is making you not able to have enough milk.
Yes.
So I was doing it, and then unaweka about 10 cc kwa syringe, and then you
push it through the tube.
Yeah. So in the tukiendelea with that, hiyo kufeed na tube, he developed some problem where he would, akisha feed, alikuwa anatoa maziwa kwa mapua na mdomo. And then he starts choking. Choking like he's going, unaona like paka macho inatoka nini. So we stayed in the hospital. He stayed in phototherapy, and there was something I experienced that somehow threw me off balance. There's this day that the doctors were arguing in my presence. Mbona ulimweka kwa phototherapy? You shouldn't have done this. You shouldn't have done that. You see, now I got confused. You see, as a mother, you're like, okay, now what was the right thing to have been done for my baby? Because these are the people who are supposed to be helping him, and they're arguing in my presence that this one umefanya wrong. No, the other one is saying this is what should have been right. We left. We were discharged after a few days, but unfortunately, the jaundice had not cleared, so it just went down a little. So we still went back home and continued with the journey of nursing him from home. But now that problem of him kutoa maziwa kwa mapua na mdomo was persistent, so it meant no sleep for me, because you close your eyes a bit, he's choking.
Baby chokes.
So I thank God for my mother, because I was staying with her. There were instances that in the night he would choke. I would carry him and go and throw him to my mom to take this baby. And she would just take him, ashughulike, amsaidie, arudi normal. Shaka naye kiasi, ndio ananiletea mtoto. And it went on for some time, because he was born in February 2009. So this problem was, especially ya kutoa maziwa. Actually, jaundice cleared after 3 months.
Oh, it took a long time.
It totally cleared after 3 months.
Yeah.
And my mom was there for me. She stopped going home for all this time to stay with me so that she could help me go through these moments. So at month 6, my mom tells me, you see, baby has, Bob, he's called Bob.
Okay.
Bob has delayed milestones. And this happens because he was born prematurely. So he will probably peak or not. But she encouraged me and told me, maybe we need to start therapy, because by month 6, mtoto anafaa kuwa na neck control. He still could not control his neck.
Yes.
So we started the therapy at month 6. So yani kusaidia tu kuboost his motor.
Yes.
And everything. But my mom saw the stress I was going through, and she decided I needed to go back to school so that I would have a distraction after work. I have a distraction to go to. And she told me, jioni nitakuwa kwa nyumba, I'll be with the baby. So as after work, you can just come, check on the baby, then go to school. So I was at KCA University hapa Kisumu.
Yes.
So I would leave Maseno to Kisumu in the evening, come for classes, and then I go back. I would reach the house around 8, 8:30 in the night. So there's this day, a week after I'd started my classes, the baby had a fever. So we gave him some medication, to Panadol to give me the fever, but mom told me I'll be checking on him. So I came for my classes. By the time I was getting back to the house, napata madhe na mtoia wako. Nauliza kwani wameenda pi? But the fever persisted, wameenda hosi. Wako kwa hosi. So I just, because we were staying in the hospital compound, nikaenda tu kwa hosi. Kufika napata the fontanella is swollen.
Okay.
Imefura. I don't remember much about that, but I remember they did a series of tests. One of them was sickler test. Wakasema iko positive
for sickle cell.
For sickle cell. That broke me, because I was like, where? The stories I'd heard about sickle cell were so scary. And I didn't know now how I was going to handle it, because already you're having a child he's not like any other child, because you've had a baby before, by now, umtoya nafaa kwa stage gani.
Yes.
And here you are, you're trying to kukubali whatever is going on.
Yeah,
because
the missing milestones, the delayed milestones.
And where you're staying, kuna wale wanakuuliza, mbona mtoi wako yuko hivi, mbona mtoi wako yuko hivi. You see, there are those questions.
Yes.
That can put stigma into somebody. So I'm fighting with that, and then I'm told that the baby has sickle cell.
Yeah.
So, but my mom decided, no, let's not take it as a final test. She sent me, there's a pediatrician, Dr. Nyabiege. I don't know if she's still in Kisumu. She used to work at district. So she decides, that was her friend. She calls her, akamwambia, my daughter is bringing her son. Akamexplainia the situation. So I came, saw Dr. Nyabiege, but she sent me to Lancet for another sickler test.
Okay.
If there's any time I was scared of opening any results, it was that one. They were giving me the results. Open your results. I'm like, no. You just better read them for me, because I don't think I have the courage to open that envelope and look at it.
Yes.
But thankfully, this result was negative. So I took it, went back to Dr. Nyabiege. She looked at it and we were happy about it. But now, this is now when she tells me another bomb. You know what? Your son has CP, cerebral palsy. I'm like, what be that? Oh, it's a condition that will persist. You will not know how it will affect him, because bado sai ni mdogo. It might affect him. Okay, CP has a way, it varies from child to child.
Yes.
I think as a medic you know better.
Yes. And definitely to our viewers we'll tackle a little bit about CP.
Kuna wale it's extreme, kuna wale it's mild.
Yes.
So here I am in Kisumu with my son, and then I've been told that
no sickle cell, but we have CP. We have cerebral palsy.
At 8 months. So she was like, you just have to continue with therapy to help him build his milestones. And we see how far it will go. But the good thing with my son, CP, kuna wale watu wenye wana affectiwa alafu wanakuwa na convulsions. Mine had never had one.
You never experienced convulsions?
Yeah. Okay. From then to now, he has never had one. So I take it into stride. We continue with the therapy. Now it's more vigorous. Because like we have to do it three times in a week. And in Maseno hatukuwa na wanaitwaje therapist.
Yes.
So I had to go all the way to Chulaimbo for therapy 3 times in a week, and it was a bit hectic because uko job, utoke upeleke mtoto hosi, urudi, upeleke mtoto kwa nyumba, urudi kwa ofisi, you work, I go to class.
Too much for a mommy. Too much for a mommy. So
after consultation with my mom and the father, we saw like their home is in Kiboswa. Kiboswa was a bit near to Kisumu because we wanted the best therapy for him. So I chose to move home so that he could attend his therapy sessions in Russia.
Okay.
So I moved home and we continued with therapy. In the process nikikuwa naenda hapo, I went to see Dr. Walter, and I think Walter did an amazing job for my son because he prescribed some medicine for him. I've never forgotten the names: inseparable suspension, Cataplas, and there's another one. I'm forgetting it now.
That's
I know
okay.
it. Yeah. So these medicines were damn expensive. They would cost me like 10K in a month. And I had to give him for a long period of time. The inseparable suspension was to help his brain. Cataplas was for his bones. And the other one, Lucifan drops.
Okay.
I can't remember what it was, but I had to give him the 3 drugs for, I don't know, I gave him for a number of years because every other time you would go for a consult with him, it would just tell you, continue with the drugs, continue with the drugs.
Okay.
So the boy, by 1.5 years ndio tulikuwa tunamfanyia supportive sitting. He had developed some good neck control, but haikuwa imekuwa perfect.
Yeah.
At 2 years ndio tusema alikuwa sasa amefikisha hiyo, he could sit, but the head would still shake. Because kichwa, but neck haikuwa imekuwa bado hivyo stable. So unaona, huyu ni mtoi normal. I mean, not a normal child. By 2 years atakuwa anatembea, anaongea. Him, he doesn't have speech. Anaweza kaa, but he wasn't sitting like in mtoi mwingine. He would sit on his feet like this because hakuweza kukaa normal. Akikaa normal ana lose balance. So for him to sit, he had to sit on his feet
in a cradle way. Yes. And I don't know, let me ask you, where mentally, where are you? Because you had even given birth before to a healthy, normal child, baby girl, who you could tell the milestones. And women, when we give birth, we keep comparing milestones even with the mtoto wa jirani. Now you have this big girl and you have Bobby, who by 6 months, something that could have happened probably at 2 months, he has not achieved. Are you comparing your babies? Is it breaking you? And who is there for you at this time? Are you voicing? Are you talking? Or you're just holding on?
The unfortunate thing is I was comparing the two even with other kids because I think there's also a neighbor who had a baby at I think same period. So you see, I would look at mtoto wake na milestones zake na za Bobby. They were different. And I didn't voice my issues. I would just internalize najiuliza mbona mimi. Okay, I felt like I think I was asking God. Why me? Why me? And I think our African society tuko na ile mentality, you have to be strong. So talking it out sometimes, unanyamaza, unacha zinakukula tu ndani pole pole. Because I was struggling with this, but I wasn't talking to anyone. Because I know I was affected because to date I cannot carry a small baby. Newborn I cannot handle. Siwezi. And even in one of my instances while leaving class in a matatu, there's a mama who came and sat to me with a very tiny baby. I started shaking. I was panicking because I was like, it kept bringing the thoughts and everything. I'm like, God, this baby is so small. It ilinirudisha miles back. I'm like, okay. Until there was somebody who was sitting next to me, alikuwa ananiuliza ni nini mbaya, nikamwambia tu I'm not comfortable. Maybe we switch places. Not that I didn't like this mama's baby, but I couldn't.
It's a trigger. Yes. The counselors, the psychiatrists, psychologists, they call it post-traumatic.
Like, actually, it happened to be somebody who works at Liverpool and he was a counselor. So that is why probably he noticed. So he asked me, nikamwambia, I just have a problem. I had a premature baby and this one is like in a trigger. So we switched places. So I had those questions, but I think I didn't feel like I wanted to burden my mom because I was already like feeling nimeshampatia. She has been there for me in this. And I would say it's my family who was there for me. The father, ish.
Okay. Okay.
Because when I moved home, all of this burden is on me. I have to foot the medical bills, to get energy therapy, that is transport, the medicine. You have your own transport now to work. I was handling a lot, but I think I kept it in me because no one chose for me where to get married. I chose myself, so I had to take it as it was. So in the process, kama bado tunaenda therapy Kisumu, that is when I got a job with a different organization.
Okay.
And I had to move from Kisumu. I mean from Huku to Migori.
Whoa.
I had to move, and it was hectic for me and the boy because I couldn't leave him behind. He was still breastfeeding and everything. And in this process, I've changed house girls because most of them are like...
That's another topic. I do not even want to imagine.
Some of them will not want to understand this child has a problem.
Yes.
Kuna ule because bado alikuwa na ile problem, ana feed, anatapika. Inatoka kwa mapua na mdomo. And some of them
were
that
not... problem persisted?
Yeah, it persisted for a long time. So, kuna ule hata alikuwa anamchapa because ati amemlisha akatapika. So, unatoka job unaambiwa, nani alikuwa anachapa mtoto yake alimlisha akatapika. So me, I wouldn't stand that. I would just tell her, if you cannot handle this, just go. Because mimi ndio najua kwenye tumetoka. Because my son at a homa ilikuwa inabidi mtenda hosi. Because atafungana completely. He will not be able to breathe. Na ndio sasa anatapika kwa mapua na mdomo. So it meant like the moment ameshikwa tu na homa, just a cold,
you run,
ni hosi. So ndio amefika, hiyo is almost 2, nikapata hiyo job Migori, so I had to move.
So you're still providing, you still need the financial stability. Yes. So
I moved to Migori with I left my daughter kwao, and I moved with my son and a house girl. And in the process of moving, tukaka like a month. I moved in Migori in January 2011, and it turned 2 in February 2011. So after the moving, we stayed March, April. Nikamrudisha home kwa mother. Now we separated with the father.
Okay.
And because we were really having a lot of issues that I think they were affecting me. I was like, I'm handling these kids' issues. I cannot also handle yours. Because they were there. They were in the background. It's just that I didn't want to base on them. Here you are, you're struggling with a child. Yende huyo na zake. So it became too much for me. So I chose to go separate ways and bring up my kids on my own. So
wow, that was
in March, before I moved home, in April I brought my son back home. I had gone to work. When I came back in the evening, my son had broken these 2 teeth, and alikuwa na bleed kwa kichwa hapa. Because unajua nilikuwa namwacha na house girl peke yake.
Yes.
So I'm asking her, nini ilifanyikia mtoto? Mimi sijui. He couldn't even breastfeed because hizi neno zilikuwa zimevunjika, akijaribu kunyonya
zinatingiza. They are almost falling.
They're almost falling. In fact, I had to go with him to see the following morning, zikangolewa because they were bad. Na amefura kichwa hapa. So I started getting worried because this is a house girl, namwacha na mtoto kwa nyumba peke yake. I don't know what happens. I'm not there the whole day. So this thing was eating me up, if I had made the right decision to go to Migori or not. So I talked to my mom, and we chose that nirudishe mtoi home, mimi nibaki Migori job. She would handle the baby from, but because at least at home my dad was there, my mom was there, her house girl was there, who was somebody mature and elderly. So the boy moved home, nikabaki Migori peke yangu. I think that was the most difficult thing I had to do, because here I am, I'm so attached to this boy, yes, with all his complications and everything. And I have to let him go home, so that, because at Migori therapy, by then, we didn't have therapists. Ile persistent kama Ksai, ama hapa Kisumu. So he moved back home, mimi nikabaki Migori. And that affected both me and him.
Wow. So you've separated and you're having anxiety, separation anxiety. And baby right now is around how old?
He's 2 years and 2 months.
Years. Please take us through how you will survive before we skip a little bit and we see the milestones probably at 5 years.
Some of those things I think I can't remember, because I think I had to put a mental block in my mind just to survive, because hata ndio ni decide kumpeleka nyumbani, I was really having issues. Uko na mtoi kitu midnight, mtoi amekuwa mgonjwa, unatoka usiku unampeleka hospitali, you're having issues with the dad, he's calling you, sijui anasema nini. So I think I just blocked my mind to avoid having a breakdown. So
and you know, Joan, our bodies are amazing. There's just a way that your body will block so that it does not suffer so much. So please, will you ever join baby back to Kisumu, or will baby join you back to Migori?
I got, as I was there, I was also working on my transfer because of baby and his condition, and I think my bosses understood. So
also the institution you were working for was in Migori and Kisumu?
Yeah.
Okay.
So in 2012, I think June, I got my transfer back to Kisumu. So I joined my son back home.
That feels nice.
That was a plus.
Yes.
And I think that is the same time when I was being transferred, he had to go for surgery, adenoids, because it's part of what was making him have to vomit all the time. So around June, July hapo 2012 wakamtoa hizo
the tonsils.
The tonsils and nini. At least it isn't that problem of him vomiting every other time. It's just that sasa homa ndio ilibaki ikimshika, tunakuwa na congestion.
Yes.
But after that surgery, he was in a better place. But therapy, bado inaendelea, medications still on. He's still not walking. He's still not having speech.
Yeah.
And 2013, 14, tulikuwa tu bado tunaendelea na therapy, but now we decided to go to Nyabondo.
Special school.
Not the school.
Special hospital?
The rehabilitation center.
Okay.
For consult. While there, wakamtengenezea nini za mguu. Inaitwaje back slab to help support the feet, and some standing aid. Yenye una have kumstrap in for like 30 minutes. And it was painful for him. We would cry, but you had to do it because that was what would help him. So unamfunga hiyo kitu, hizo back slab, unamwekea kwa mguu, alafu unamstrap kwa hiyo some standing aid, unamstrap hapa na huko kwa miguu chini.
Imsaidie kusimama.
Kusimama. So and would stay in it for like 30 or 40 minutes on a daily basis. Sasa hiyo tulikuwa tunafanya home, but still bado unamleta therapy. But sasa venye tulimpeleka Nyabondo, nikaona for rehabilitation sake, and my mom was like, I need to give the boy some independence. I need to get also some tulikuwa tumekuwa ni kama we co-depend on each other.
Oh yes.
So she chose like, okay, Joan, but we'll have to be in Nyabondo for some time. It was not an easy thing to accept, but he stayed there for almost a year and a half. But by the time he was leaving Nyabondo, he was walking. and had some speech.
Yes.
Because they used to have some wazungus who would come there. I don't know if currently there's a speech therapist actually in these public hospitals, because speech therapy has been a problem, I think, in Kenya. So there were those wazungus who would come, who would help them with the speech therapy. So by the time he was leaving Nyabondo, after about 1.5 years, he had some good speech.
Nice.
And he was walking, though with gait, but
Yes,
alikuwa anatembea.
You mentioned something called, you were like codependent. And that is you and Bob. And there's somebody very special to Bob we are forgetting. How is your relationship with the sister?
I think I failed there. I think I failed my daughter there, because I gave most of my attention to Bob. And because after she didn't join me in Migori,
okay,
but later she went to boarding school. So kulikuwa na hiyo gap.
Oh, there's a gap. Okay.
I was not there for her, and I had tried to make the dad akue there for the girl, but pia yeye alikuwa tu vile alikuwa.
Okay.
So
okay.
To date, we have our issues, and sometimes I know I blame myself because I was not there for her. I think I gave Bob most of my attention, and I forgot she existed. Not intentionally.
Exactly. Yeah.
But because of the circumstances.
You had to do what you had to do. Yeah.
And sometimes I think I expected, like, she has to understand Bob has a problem, and which was not right, but it happened.
And what is the relationship of these two children?
They argue like normal siblings. You should get them.
So they have their beautiful moments, and they have their, you know, but they are there for each other.
They are there for each other.
Between them, they can fight, but an outsider, you will not come.
No.
Beautiful.
Come.
That is amazing. Okay.
So Bob left Nyabondo, and that is when I was staying home. My home is in Tigoi.
Okay,
Before, I used to commute from home to work. But now it imefika point, Bob has to start school. I don't know where he will go to school. This is a special needs child.
Yes.
I start looking for schools in Kisumu. The first one I got was uko Mamboleo. Ilikuwa inaitwa Acts of Hope.
Okay.
So in 2015 or 16, because he left Nyabondo, I think mid-year of 2015. Though pia huko alikuwa anasoma, 2016 akaingia, 2015 akajoin Acts of Hope. But due to eventualities, I think I looked for another school. He joined Levis Haven.
Levis Haven.
It was now in Nyamasaria.
Yes.
And there they did an awesome job, because Bob could, he can do, as per now, or then even up to now, he can walk, he has good speech, but he doesn't have fine motor with the hands.
Okay.
So feeding, he still has to be, he doesn't, haumlishi.
Yeah.
Like, if it's ugali, lazima umkatakatia into small pieces, do like a mixing of everything,
yes,
and then give him a spoon, because a spoon he can eat with. But kupika kitu hivi na mkono, hana hiyo fine motor like any other child. And then he cannot write for himself. So even in school, anasema tu kila nataka, na mtu anamwandikia. So he doesn't do it for himself. So he joined Levis Haven. There they did a good job. Bob was able to speak English, answer questions. They were doing therapy in school.
Wow.
That was at least easy for me, because in this other school, ilikuwa inabidi, maybe you have to make him miss school so that he can go for therapy.
Yes.
And blah, blah, blah. But huko, ilikuwa, everything was in school.
It was holistic.
But unfortunately, I don't know what happened, but it eventually closed. So we were back to square zero again, looking for another school. That is when we ended up at Joyland, which is a public school.
Okay.
Yeah. Currently, hakuna private school in Kisumu that yenye ina run for special kids. But public school is a public school.
It's a public school. Yeah.
So that is where we are. Okay, that is at 5 years, 6 years now ndio ameingia shule. Akipewa homework ni nyinyi ndio mtamfanyisha home nini ama any class work, ita have kukuja home, nyinyi ndio mta have kufanya, because he cannot do most of those things on his own. Levies haven't, they would help. Toileting we still have to help him do, because hana hiyo fine motor, and si haizi enda kwa Indian toilet, it has to be this toilet yenye mtu anaweza kaa because of his situation. He cannot squat like and no a normal person vile unaweza squat yeye hawezi. So we still have to, a number of things we still have to help him do them because of his condition. So in Joyland, I mean after Levies happened, that is when we joined Joyland in Joyland. Actually, after Levies Haven, we did homeschooling for a while, because we didn't have a school.
And you are, and Haven had already put your expectations up there.
So for a year or for 2 years, we did homeschooling. And with the homeschooling, I think hapo ndio pia CBC came in. And then now we got confused, because sisi tulikuwa tumeendelea na normal class 1, class 2. He was doing class 4 by then now. But now CBC has come in. Sijui amemiss exam ya class 3, because I didn't even know alifaa kufanya mtihani. So we have to take him back to do exam ya class 3. The time he's supposed to go to grade 5, he has to have kurudi grade 4.
And because he cannot write, when it comes to exams, do they have a provision for only speech, you know, like an oral exam?
They don't have an oral exam. What they do is, wanampatia mtihani, he reads the questions.
He can read.
Yeah, he can read, and then somebody writes for him his answers. Now the school
provides
an exam, through the examination board. Wana have kuandika barua huko when it's national exam. Wanaandika barua, mtu anakuja ndio anamwandikia exams zake. So that was that period. Now we did homeschooling, and then now that is when Joyland came in. But Joyland came in after COVID. COVID pia iliturudisha nyuma kidogo in classwork and everything. But with time we started picking up again.
All right.
Yeah. So bringing up Bob and Kerry at the same time has been a journey. And people will want to tell you how to bring up your child. Mtu atakuona na huo mtu yeye anaanza kuambia umempeleka mahali fulani, umefanya nini? They do not know what you have gone through to be where you are.
Exactly.
They want to give you, even in matatus utapata saa zile mnaingia hapo nyuma, you would get into a matatu and somebody would start asking you, nini mbaya na mtoto? Now you're like, okay,
where do I start?
Am I supposed to be explaining myself to everybody? Like, this is what is going on with my son. Inafaa nikifika mbele ya kila mtu naanza kujiambia, msitu angalie sana.
Ama excuse me.
So that you avoid the stares, and one will get the courage and ask you that question. Kwani what is happening kwa mtu? Kuna wale watakwambia tampeleke kwa Ezekiel. Mpeleke sijui wapi. Like, okay, fine. But we have embraced our issues. Bob mwenyewe accepted himself, though sahi ndio naona akona a slight problem, because I've been trying to like make him get exposed. Nataka nimwambie duka iko pale, siende ulete kitu fulani. Kwambia mami siendi. Kwa nini? Tunasikianga watu wakiongea nikipita. So there's that stigma.
And now he's 16. Pia kwa adolescent, he's very sensitive with whatever is happening around him. And I think we have quite a lot to talk about, and we can put it at rest here for today. and pick it up. But before now we get to now adolescent and what Bob is doing now as an adolescent child, parent, and an adolescent child, you have touched on the community and how it wants to advise and talk. What can be your parting shot for now to everybody who might be a caregiver, might be doing advocacy, which I think now already Bob is doing because he's now outside there, might be a parent or even a mom-to-be who is very scared because she has seen a family member, she has seen a friend. What are those few points, 2-3 points that we can tell them, or you can tell them from that parent who has been there?
For a parent who, as a parent to a special needs child, number one thing I would really try and ask most parents when you wako na watoi kama hao, please don't hide those kids. Kumficha ndio kumgandamiza. Just try and it's not your choice mtoi alizaliwa vile yuko. So expose that child so that that child can grow knowing what is going on in life. And two, we need to have easy groups, support groups for parents. It would really help because I feel most parents, they don't expose their children because wanafichwa and there is no support groups to help them go through whatever they are going through. That is one of the things that I would say. And above all, I think acceptance is the key thing, because even me, for a while, I couldn't just say my child has CP. It took me days or years to accept and say he has CP. But acceptance and letting the child even accept themselves the way they are, because I've taught Bob, mtu akianza kumwambia, oh, wewe uko na sijui, kuna wale wanamwambia uko na polio. I tell him not kataza, say I have CP. So that mtu pia mwenye akijiaccept, then it gets easier for him to interact and live with it.
Yeah.
Yeah.
Beautiful, Joan. I am so proud of you. Very, very, very proud of you. And you are doing also a lot of advocacy. I see you celebrating Bob. When you are looking for the best for Bob, it's all about advocacy for your child and also for many, many children that you do not know which parent. So, our dear viewers, the ones who subscribe, the ones who will even come to subscribe and watch many, many, many years to come. This is the Mamatoto Lounge, where we speak and we discuss and we learn and unlearn parenting unfiltered. You have heard it from Joan, a very, very strong and beautiful lady who has been there, and she's still there, putting on a very courageous face, but she has told us very tiny little pieces of her story unfiltered. What is your story? Would you want to be our next guest? Karibu sana. It is at Mamatoto Lounge. Keep on subscribing and sharing. We are at Premier's Hotel Kisumu. Karibuni sana. For this to get to on your desk, it's because of the team, and that is Chanuka Studios in Kondele. You can always visit and engage them, and their contact as well are shared in here. We'll see you till next time. Keep it here for another season and another session that we are going to have. Thank you. Till later. Bye.